I am extremely grateful, as I've been many times, to the American Syringomyelia Alliance project. Extremely grateful to Dr. Levy for hosting, and extremely grateful for allowing me to present something that is slightly off the keel of the fantastic scientific and clinical research papers you will hear today. Along the years, as all of us, all the neurosurgeons here, we established a good relationship with colleagues from different countries of the world, of area that we call the low and middle income countries. We all have friends and dear colleagues from Nicaragua, Guatemala, Kenya, Cambodia. And along in these conversations with them, I learned to appreciate and admire the fantastic intellectual and clinical and surgical ability that they have. They often have correspondence with me, as with Dr. Levy or Dr. Bolognese or Dr. Basdorf, about issues pertinent to pediatric neurosurgery, such as what is overdrainage, tether cord, craniopharyngioma, all those questions that are part of the phenomenon of not knowing exactly what to do and expresses the complexity of the patients. And in the last 10 years, I had a stronger relation with the medical teams from Nicaragua for one of those events in life that happens, and eventually I end up very close to surgeons from Nicaragua. So what I will tell now is based on the Nicaragua experience, but expresses the experience of all the other part of the world as well. The benefit of a conversation with the surgeons of Nicaragua is this. It's a small country, 15,000 square miles or something, or 50,000 square miles. I mean, it's a small country. And a huge lake in the center, a population of 7 million. And as every country in Latin America and most in Central America, they have a strong capital city. Managua, in the case of everything goes to Managua. People in Nicaragua, they built a neurosurgical and neurological referral hospital in Managua. So every time, every complex case from different areas of the country, be it Estelí, León, Bluefields, they come to this hospital, the Antonio Lenin Fonseca. And the surgeons over there do have a clear idea of the healthcare panorama in the country pertinent to neurosurgical pathologies. I visited that hospital many times. And they also have a central children's hospital, La Mascota. So every complex pediatric cases. And as you can imagine, where I'm going is every time I ask my colleagues and some of them dear friends, how many cases of Chiari you see? And they say, Chiari, you mean that? Yeah, that. One? What do you mean one? Okay, two, if you are upset. We saw two. Last year we saw two. And that always puzzled me. That's what I call Chiari, the stealth condition. According to the textbooks, the incidence of Chiari is 1 per 1,000, which sounds exaggerated. But imagine in a population of 6 to 7 million people, at least has to be 700 patients who not only have what we call Chiari radiologically, but actually suffer from the condition. And they are in the stealth scene. They are not seen. No? Why is that? Those dear colleagues who asked me, again, questions that express how fantastical clinical mind they do have, how they understand, how they care, they don't see patients with Chiari. So I was working on trying to explain this phenomenon. With two students we brought to Chicago last year, students from UCLA, we did an extra-official study to see how many papers about Chiari are published by authors other than from the United States and some countries of Europe. Very few, almost none. Or most of them are case reports. Nobody writes a series on Chiari. So I asked my colleagues, okay, why is this issue? Why Chiari or neurological diseases are not well looked after although not all the neurological diseases, as I said, they have a hospital devoted to neurological diseases. They do see gliomas, they do see tumors, spine, complex cases, but they don't see Chiaris. And the first thing that they blame is to the WHO. It says the WHO provides money to the state, to each of those small countries. It's not the issue of the United States or France. Or gives money to, say, to Nicaragua. And the only standard that they have to answer, rightly so, is maternal fetal health. If a country or the health system of the country fulfill the requirements, the next lot of money will be coming the next year or whatever cycle they do have. No? And so the government per se, and remember those are centralized countries, countries, and Nicaragua has a proto-dictator. Although it's a safe country, they have a reasonable healthcare system. There is a good communication between different areas of the country, except from the East Coast. But it's a livable country. And if you see the image on the left are a study of the burden of disease published in the Lancet at the beginning of the 2000, or so means 23 years ago, 24 years ago, because it was just prior to the millennium. And that thing has not changed a lot. You will see the diseases that concern the public health, the WHO, are infectious diseases, transmissible diseases, dementia, cardiovascular diseases, cerebrovascular diseases, but there's no space, there's no room for conditions like Chiari. There's no room for conditions for any other of the so-called rare diseases of the central nervous system, being hydrocephalus. There's none. Yesterday, I went to the page of the Lancet. I took this a screenshot that says latest content on burden of disease. There is only one paper that may be related a tiny bit with what we are trying to do, which is a study funded by the Bill Gates Foundation about low back pain. Low back pain as such. Okay, the Gates Foundation gave money to study that, which is a very unprecise issue. I wasn't included, and I have sometimes low back pain. So the overall study that is in there doesn't mean anything, but people have this feeling, oh yes, I'm doing something. We are giving money to low back pain. Oh no that. And I looked in the Lancet global burden of the disease. Yesterday I put Chiari malformation research did not return any result. So yes, there is this perception that neurological diseases, like Chiari among them, are issues that are not there, but are not there. You know, we focus on tuberculosis, we focus on heart and the brain and dementia. Rightly so, I'm not objecting that. I say that has to be room. And my question again is why we don't see Chiaris, why our colleagues in different countries don't see patients with the frequency that we see them here in the United States. And the neurosurgical diseases still exist. This is an op-ed from 2003 from Dr. Hosseini, the novelist, the kite runner, I think. And he's a University of San Diego medical graduate. And he is telling there that in Kabul, in the middle of the previous drama that country lives, he is looking for a shunt, for a VP shunt to place on a child who has a brain tumor. And he finds the shunt through a doctor in the black market. So if you have a black market for shunts, as the same as you have a black market for Johnny Walker or for cigarettes, is because those things are sold in the black market, that the people in the black market do not collect things that they will not sell, and that they are selling things like shunts or for hydrocephalic shunts at a condition not contemplated by any of the parameters of the WHO. It clearly means that, yes, indeed, neurosurgical conditions are a reality, and they do exist in other countries than our country. We, and I know Dr. Levy does a lot, and many of us did, and I was engaged, we all did those series sponsored by NGO or by churches or by both or by individuals, trips or expeditions or so-called missions where we go to some place and perform 25 or 30 surgical procedures with a team, no? For a week or two. And I've been involved in that for many, many years and never ever saw a child, I do pediatric, that's why it was my focus of attention, ever saw a child who had Chiari. Again, what I'm saying is the stealth disease. We in the United States have a Chiari Institute. I'm not expecting Nicaragua to have at the Chiari Institute, but come on, tell me about 5 cases or 6 cases, or ask me one to contact you with somebody about some of the problem that you have, no? And the mistake, and I put at the paper I wrote there to see that I was part of that mistake as well, is to consider everything in cost effectiveness, no? I mean, are we going to spend $20,000 or $20,000 in Nicaragua or in Congo to take care of you if with the same amount of money we can vaccinate half of the population, no? So we have this sense, this mind of cost effectiveness that, God bless the heart of the WHO, they also have. It is effective to treat, say, 120 patients who may have Chiari in Nicaragua or in Central America. And I'm sure if we add every country of Central America, Mexico being North America, we will reach 2,000 or 3,000 cases. But is it worth? And this is the mentality that I had, as you can see in that paper I wrote with a fantastic medical student then and now accomplished neurosurgeon. Cost effectiveness. Is it effective? Is the cost effective or not? No? And that idea has to be challenged. The second explanation, those are explanations what's up by my friends in Nicaragua, no? And even the latest letter is in there translated. The second explanation is the perception that pediatricians and people have about every condition that involves the central nervous system. No, we all think, that's their words, that diseases of the central nervous system are not treatable, are expensive to manage, interfere with high level, loss of productivity for workers, time and resources to care for disabled family members. These issues that are not as strong, do not have a stronghold here in the United States, they do have a stronghold there. So, yes, you have the brain tumor, you just cannot move it, terrible headache, unsupportable headache. Yes, you go to the hospital. You have any of the symptoms that you know much better than I do, the patient with the Chiari can have, maybe will not go. Because, they will touch your brain and you don't know what happens after. And the third best explanation is education. Education of the physicians and of the public. This is a book, Best Doctors, Better Patients, Better Decisions, and was a consortium, a symposium, a well-studied book. And this is contrary to popular opinion. One of the main problems in providing uniformly excellent healthcare is not lack of money. It is lack of money sometimes, but lack of knowledge on the other part, both doctors and patients. So how can we improve this situation? What can we do specifically as Chiari Group to address this the situation? And this is the letter that the lead pediatric neurosurgeon wrote me yesterday. And because I said Chiari neurosurgery in Nicaragua. And I will not write just in honor of time extensively on there, but basically what he's saying that nobody talks about Chiari. This is an issue that seems that doesn't exist, although they are aware, described long time that the posterior fossa, they know the measurements of the posterior fossa. But yeah, it is unbelievable. We are here in beautiful San Diego, and we gather every year to talk about this. There are myriads of the papers in different journals. We have a Chiari Institute. We have, everything that we have. And still there is a stealth disease. There is like a black cloud outside of the United States, so south of Mexico, and extended into Africa and into Asia. The tool, and there are 3 more slides. The tool that I was trying to work on is this. Zoom improved with the pandemic, but prior to the ability of Zoom, we had webinar or Cisco webinar, one of those things. And through those things, I was able to frequently give lectures, standard set of lectures to different medical schools in the world. The mistake then was that instead of focusing on Chiari, something that dawned on me last year, instead of focusing on Chiari, I was focusing on the general concept, how to think about the congenital malformation, how to have a conceptual understanding of the brain through a set of congenital malformation, not specifically as Chiari. And just this is briefly. Yes, I'm not wearing my glasses. So what I'm proposing is a international alliance. An international, global is too big. International is between this nation and this other nation, no? With one nation to another nation. And those are examples. This is at a classroom in Peru. I am in the bottom there. Of course, I am in Westwood. The same with El Salvador and the same with Nicaragua. But the mistake with all those students in 10 years was I didn't put enough emphasis on Chiari. And since last year's conference in Chicago, dawned on me, or shall I say, had this thinking of revelation that, that the problem is Chiari. Why we don't get more Chiari? I am now engaged teaching the neurosurgical teaching hospital in Baghdad. I am broadcasting from my room on Friday at 11, every Friday, and was the only subject I taught to them through a structural, logical way. Was the only subject I taught to them. Chiari begins with C and ends with I. Is the only thing. And through the Chiari, we go not a description. Chiari is a disease where the cerebral tonsil. No. That is in the book. How can we interpret a diagnosis? How can we bring the diagnosis to the anatomy? In other words, how can we create and expand the understanding of Chiari? And why we need them? Because they see a lot of patients. They may one day come with a solution, perhaps not to our problems now, but to the problems of the future. If we get one of those or two of those, if we double the number, we will be an incredible amount of wealth that we can bring to this problem of Chiari, besides making the possibility of the developing of a Iraqi Society Association of Syringomyelia of Chiari or a Nicaraguan. So for the moment, the proposal is to invite to our meetings a neurosurgeon from the so-called low-middle-income countries to engage, to discuss, eventually present his or her experiences. And I gladly will take care of the travel and lodging of that person for the next 5 years. And then we see 5 years from now when we are back in San Diego, and then we say, yes, it was worth the effort or wasn't worth the effort. But I think that our society, your society, has to expand. Let's continue being American, but in an expansive way as such, in such a manner that the stealth disease that Chiari is now wouldn't be any longer in other countries. Thank you. Thank you. Thank you.